of Optimal You Radio. I am your host, Dr. Bob Barano. Today, we are going to do a deep dive into chiropractic care. What the heck is that? And I am very fortunate to have with me my very old and good friend, Dr. Deb Hudson of Gator Family Chiropractic. So, Deb and I actually, we've been doing this almost 30 years, just about.
Yeah.
And we went to chiropractic college together, kind of unknowingly, but met when we came here to Gainesville back in 98, 97 to do our internship. And then we were interning with two different doctors, and then they would get together like once a week to adjust each other, and then that's how we met, and been good friends ever since. So today what I wanted to do was, this is gonna be a little different because this is gonna be an interview both ways, okay? So I'm gonna ask her a lot of questions and vice versa. Now here's the thing, we know the answers. And so if we start talking kind of a little too much inside baseball, one of us needs to catch each other and say, slow down. I don't think everybody knows what xiphoid process. So I don't know. So if we start using some weird terms, we're gonna try not to do that. So let's start with an intro for Dr. Hudson here. So give me the rundown. How'd you get into chiropractic? You're a UF grad, right?
Correct, yes.
Okay.
Yep.
So and would you?
I wanted actually to be a veterinarian
Right.
most of the time that I was at UF, and then my TAs were getting done with vet school and telling me that they were gonna make enough to live like they were currently living and pay back their student loans, because at that time it was like $250,000 to open a vet clinic. So I was like, okay, maybe I need to redo what I'm gonna do here. So.
All right. So you had that biology undergraduate degree, basically, and then how did you get to chiropractic?
Honestly, I had never even been adjusted by a chiropractor, but everybody I knew that went to a chiropractor absolutely loved it. So I thought, my God, I want to be a doctor that people actually want to see.
Yeah. No, that's a good point. People are excited, unlike dentistry. Oh, to be honest, I go see my dentist. I see him tomorrow. I like it. It's a positive experience. It's a comfortable experience. Like the new technologies, very clean office. I like and I like the people too. And I think that's kind of what we bring to the table, hopefully.
Yeah.
So you finish UF, you go to Life University up in Marietta, Georgia, just north of Atlanta. And you go through that program and you decide to come back to Gainesville.
Yeah, my parents were living here, so I was like, well, I want to be near my family, so I came back to UF, and
So some questions that patients ask us. So I'll have patients come in and say, so what is that? About a 12-month program? 6 months.
I wish.
Yeah. So tell us a little bit about the program if you can remember. It's been a long time.
So well, in Florida, back when we both set up shop, you actually had to have a 4-year degree before you could even go to chiropractic school. And then chiropractic school was another 3.5 years if you went straight through,
right.
which I think both of us did that. But yeah, it's very in-depth. I mean, the only difference between us and medical doctors is we take no pharmacology classes. So when they were busy learning about all the drugs and how they interact with the body, we were busy learning about the central and peripheral nervous system, because the nerves are it's important with chiropractic. I mean, the spine actually houses that spinal cord, has all the spinal nerves coming off of it.
Here's what she's talking about. So, this being a model of our spine, this is obviously the occiput of the back of the head. This is where the brain sits, and the brain extends all the way down via the spinal cord, right? It's in the middle of all these joints, and then off of that spinal cord are those nerves. And those nerves, it's basically a wiring system. And if you think of it like a computer, that brain sits there almost like the central processing unit of the computer, and all day long it's just sending information and receiving information and coordinating not only movement and muscular function, but organ function as well. So that's the structure that we work with.
Yeah.
So let's tell the folks here. So what happened? What do we do? I know we make popping sounds.
Yeah.
But is that popping sound the actual adjustment?
It's actually just gas being released from around the joint. So the joint is what we call subluxated, and it moves laterally. And then when it moves laterally, it compresses the nerve. So whatever tissue, muscle, or organ that nerve is innervating, it's not getting the complete message from the brain down the spinal cord and out. It's being compressed, and so it's only giving part of the information. And so our job is to restore that subluxation. So we adjust that joint, makes a little popping noise as the gas is released from the joint. And then function is restored.
Yeah.
So people come see us mostly out of pain, but
Yeah.
I try to tell my patients that the pain is like just the thing that brings you in.
Yeah.
What we are trying to restore is get you out of pain and restore that function, and so your body can,
No, that makes sense.
be 100%.
That's kind of how I described it as well. It's like, I think a lot of people have the impression that we try to line our way nice and straight, and just it's not really the case. Everyone has twists and turns, and they function perfectly fine. And so we're really more concerned with how are those joints articulating, because each one of those vertebrae, right? Each one of them should have their own independent range of motion. And the only time we'd ever put a force or an adjustment into that joint is if one or more of those joints got stuck. Because what ends up happening, as she described, not only does that joint get stuck, but your body's going to figure a way around it, and so that means the joint above it and or below it have to do more work. And when something gets overworked, eventually what? It becomes inflamed and potentially swollen. And it's that swelling that puts pressure on the nerve endings that creates that pain signal. And yeah, that's what drives us in here, patients in here, or drives someone to like pop ibuprofen or get cortisone injections. All, both of those are to help reduce the swelling, but neither of those help improve the function. And so then you end up in this cycle. So yeah, the popping sound isn't necessarily the adjustment. It precedes, it comes before the adjustment, because when you open up that joint space, like you said, that gas releases and makes that sound. I liken it to like if you have a soda can and you open that soda can, that compressed gas escapes and makes that sound.
Yeah.
Same deal, same deal.
Absolutely.
All right, so what are kind of some of the common things that you see in your practice? Like,
I would say probably mostly neck pain, low back pain, headaches. Those are probably the three biggest.
yeah, and is it always a joint component, or it could be other things as well?
I mean, certainly it can be muscular as well, and in fact, most of the time I treat both the muscle and the bone. I do the adjustment and then I do some muscle work, because I mean, if you have all of these tight muscles attached to these bones and you don't do anything to relieve the tightness in the muscle, it's going to pull it right back out of place. And so, I mean, that's why we always have this conversation about some other chiropractors. They want to see their patients like 3 times a week, but they do nothing for the muscle, and so they need to see their patients 3 times a week. I mean, I'm not trying to take, everybody's money and see them 3 times a week. I'm trying to do my job and get them well as quickly as possible.
We're in a very interesting business model, because our business model is we want to reduce how many patients we see.
Yeah.
I mean, that's kind of an ego thing. Like, if I can get you, but that's not the case in most practices. Like for us, man, if I can get you fixed in 2 or 3 treatments, like that feeds my ego. And if it takes longer, then I start getting
Right, but we also have to remind ourselves, if somebody's had a problem for several years,
Yes.
I mean, as good as we are, Bob,
Sure.
it will take a few more than
for sure,
a few
for
more
sure.
visits to
Yes,
fix that.
but they were constantly trying to eliminate our patients. I mean, it's a good thing,
Right.
and that's probably not a a normal business setup. But but ultimately, that's
Yeah, but I mean, people are living life, and we're always getting the bumps in the road, and so we're gonna go back out at some point, and they're gonna trust us that we know what we're doing the first time around, so we'll be able to fix them again. So
no, exactly. So besides the you mentioned the adjustive work and then the muscle work. Now you also do another therapy. It's the red laser therapy.
yes, red light laser, yes.
Tell me a little about that, because I've heard about it. I hear different athletes using it for injuries and certain kind of things. But what is the overall purpose of that?
So basically, photobiomodulation is what it's called, and so you're taking a red light that is at a high frequency and putting it into the cells of the muscles and tissues. And so what that does is it actually speeds up cellular respiration. So we all had science class where we learned about the Krebs cycle. Most of us don't remember anything about it, but the whole thing with the Krebs cycle is you can either produce 2 ATP or 36 ATP. And so when you have an injury, the body kind of gets into that negative cascade and it only produces 2 ATP. Well, ATP is the powerhouse of every cell in the body.
I do know this one, adenotriphosphate.
Yeah. And so if your body's producing enough energy, then it's able to heal itself faster. But when you're not producing enough energy, then it kind of slows everything down, and you stay in that stuck phase of being subacute injured.
Okay.
And so what the laser does is it actually produces more ATP molecules
So
so
you
that your
can
body can
heal
heal
faster.
faster.
Got it.
Yeah.
So, all right. So yeah, I guess in my brain I was thinking, okay, it's like an ultrasound. It reduces swelling, but no, you're saying in addition to that,
Right.
it speeds up that tissue healing process.
Yeah. Absolutely.
Man, I
Everything
guess
the body naturally does to heal, it's going to do it that much
All
faster.
right, I need to get on your schedule. So a lot of things I gotta get healing fast. What's sort of the turnaround with that? Like number of sessions and.
Really depends on the length that, if it's a chronic problem, it takes more sessions, clearly. But like an acute ankle sprain,
Yeah.
We would see that patient like twice a week for like 3 or 4 weeks, and then
Okay.
they're done.
Do you do it for like neck and back pain?
Absolutely, yeah.
Okay. All right.
Yeah, any kind of muscle or tissue spasm or pain.
How long are treatments?
Literally like as short as 4 minutes up to like 8 minutes. They're
So
very
it's
quick, very quick.
And what's a typical like a treatment plan? How many visits, how many treatments for someone to like notice some response to that? I know it probably depends on the.
Yeah, honestly, most of my patients say that they notice a difference after the very first treatment.
Oh, that's terrific.
Yeah.
Any side effects, negative?
No.
Okay. That's pretty good.
Yeah.
What else we have in that? Oh, you do some stretch work too.
Yeah.
Some stretch there.
Yeah, a lot of offices don't focus on stretching a muscle.
Yeah.
We have massage as well, which releases tension in the muscle, but the good thing about doing the stretch work is that you're actually lengthening those muscles back out, and so that they won't hold as much tension if they're lengthened to the proper state. Like almost everything we do in life is contracting muscles and tightening and shortening, and so none of us stretch enough.
Yeah.
So, and flexibility as we age certainly is one of the most important things, because they say that loss of flexibility is actually the single best indicator of loss of range of motion.
Have you seen that that test where they'll take a patient and they'll say, okay, I want you to from standing position to sit on the floor and stand, and then depending on how many points of contact you have to use to stand up, it's supposed to give you an idea of how long you're going to live.
Yeah, I know, that's
We should
crazy.
do that.
Yeah, we should.
Caitlin,
Yes,
have you seen that test?
I have not.
You haven't.
I have not.
Okay, so you know what we're going to do here in just a few minutes. We're gonna cut, and we're going to demonstrate that test.
Okay.
All three of us.
Oh gosh.
But anyway, so we talked about like some of the chiropractic. So what are some of the misconceptions do you think that are out there about what it is we do?
Well, I get the question that, I've heard once you go to a chiropractor, you have to go for the rest of your life. And I always tell my patients, well, it's a choice. I go, once you feel really well in your own skin and you know how your body feels when you're well, then you generally choose to go when you're not feeling, but it's not something you have to do. But certainly, like, I don't tell my patients they need to come every week or anything crazy, but like every couple of months for a little checkup, then it's certainly just for maintenance. It's definitely important.
It makes sense. And when I hear that, I'm like, you have to exercise more than once in your lifetime. Or you have to eat more than once in your lifetime. So that never held water for me. Well, what I used to get a lot of, I don't get that much anymore. And there's been a big change since we started practice to where we are today. Like when we first started, you had to have pretty thick skin, because every one of your patients would come in and it's like you were like their secret. Like, I don't tell my doctor that I come here, so don't tell him. He probably won't see. And now we get referrals from neurosurgeons and orthos and primary care docs. So it's definitely come a long way. I mean, back then we were talking about exercise and supplementation and all that, and that was voodoo back then. So things have kind of come full circle here, which is great. It's great for us.
I mean, now people bring in their little children. I mean, I have little babies that get adjusted right after they come out of the womb. So
that's awesome. And, I get asked about that. Like, that's not my comfort level, so I refer to you for that. I see a lot of like teen athletes, sort of when I see a cheerleader today, and it's I think the youth sports, the youth sports is like junior professional anyway. They're traveling, they're taking flights for tournaments all over the country. For middle school, sports.
But honestly, I don't know that that's so good, because there's so many injuries that these kids are suffering. Normally you would never even have that injury, and unless you're an adult.
Yeah.
So it's really
Well,
neat to
because
start
there's a lot of
looking at
overuse. Like, you know,
Yeah.
they're practicing 5 or 6 days a week, and
Yeah.
you know, take like a baseball pitcher. You know, that poor little arm
Yeah.
is just
And then they're
getting
going home and
abused.
practicing even more.
For sure,
Yeah.
yeah. So it's
Yeah,
it's
it's
gotten pretty
crazy.
intense, but they've also taken their recovery pretty pretty serious as well. Like you said, over the summer I worked with a golfer and a basketball player. I mean, these kids are locked in to their sport, which is actually inspiring to see. Like, I was never locked in to anything. Like, well, a couple things, but it wasn't sports related. Well, it's sports related. We'll leave that for another conversation. So yeah, it's definitely it's come around. So I'm still excited. I have 30 years. I'm still excited to come into work and to like every day is it's almost like a mini reunion. So I'll see a patient a couple of times, and it might be a year before I see him again. And so there's always like a lot of catch up. As a matter of fact, like I got Caitlin knocking on my door after about 15 minutes. She's like, "They're waiting on you." Let's go. But I just enjoy it. I enjoy it.
Me too.
So it's a fun part of it. So we're going to take a pause here, and we are going to set up, and we're going to do the longevity test. We'll call it that. All right.
Okay.
And we're back with the longevity test. I would say don't try this at home, but actually I want you to try this at home. So here's what we're going to instruct you to do. So you're going to start in a standing position, and then without using your hands, you're going to sit onto the floor. Look at that. All right. Now, she didn't use any hands on her way down, so this is scoring out of 10. So right now, she's a 5 out of 5. Every time you have to touch a knee or a floor, that's a point. So let's see if she can stand up now without touching anything. Look at that. 10 out of 10, Deb. Nice job.
All right, Bob, your turn.
Oh, wow. I am nearly... okay, I'm going to try it. So we're gonna stand up. I'm gonna cross one leg over the other, and then I'm gonna sit down. Look at this. Okay, we're good here, right? And now the hard part. Oh, actually, that wasn't too bad. Hey, all right, so that's not too bad. And I do not have very good mobility. Ask my coach. And speaking of which, I think we need to see if she does it as well. All right, coach, what you got?
Crossing my legs.
Cross.
Sit.
Oh,
Stand.
please. All right, so I hope that kind of sheds some light on what it is we actually do here at a chiropractic office. If you've ever considered chiropractic, or maybe just were a little fearful of the delivery system, I think that's one of the things I hear. Like, I don't know about the twisting and the popping.
Well, is there another technique that
Yeah, of course. There's one of the things that we use in our roster, we have for 7, 8, 9 years, is this particular instrument adjusting. It's kind of taken a lot of the guesswork, if you hesitate to use that, but a very accurate instrumentation allows us to identify these joint fixations and actually correct them without that traditional twisting and popping that is a little fearful. Even though my malpractice, if there was an inherent danger to what it is we do, it would be seen in the amount of malpractice
we
insurance
pay a lower malpractice than any other doctor.
Yeah, and matter of fact, my malpractice insurance is less than my car insurance.
Yeah, isn't that crazy?
It is crazy.
I love that though.
And so
I love that for us.
What that tells you, because the insurance company's not going to cut anybody any favors. Let's be honest.
Yeah.
And so if there was an inherent danger to what it is we do,
Right.
we'd be paying for it, and there simply isn't. But it makes for good headlines, and that's why every 5-10 years it pops up. I think I saw something recently that just popped up, and there used to be a lot of people that jump on that hate bandwagon, but not so much anymore. I was kind of reading through the comments. I just wanted to get a vibe of where the culture is, and
Yeah, a lot of
there's
people,
a lot more supportive comment.
Absolutely, yeah. People
So-
love their alternative care. It's not so alternative anymore.
No,
A lot
not
of
at
us
all. As a matter of fact,
use this as mainstream.
I think even with the rising healthcare costs of surgical intervention, or multiple PT visits, even with insurance, it's still very expensive.
Right.
Yeah, what we do is very affordable, effective, and efficient.
Right.
So it kind of checks all the boxes. So yeah, I mean, how does someone get in to see you or us?
So all they need to do is look us up on the web and
Get your family chiropractic or anybody Bachelor's.
Right.
And it's pretty easy. Like we
We
have
both have that online booking even.
Yeah,
so
it's pretty cool.
Makes
So
it easy and
you only have to make a phone call, log online, which I kind of like that. But once you get in here, I like to talk. No, you do too. So there'll be a lot of chit chatting, but yeah, we do a thorough evaluation on the first visit to see if in fact it's a chiropractic case, and if so, yeah, we kind of lay out the different options, and we look to see like the effects of that pretty early on.
Yeah.
So yeah, not a lot of mystery to it, and yeah, we try to make it easy and convenient for you. So if you have any questions, honestly, just direct message us, DM. You can slide into our DMs, right? And or you can give us a text or a call, and we'd be glad to sit down and talk with you. Look at X-rays or MRIs, any diagnostic studies you might have, and we'll go from there. We're not scary. So hope to meet you soon. Take care.